Okay, so next we're going to be doing transdermal patches. So before applying the patch, we need to know the knowledge of the medication, do our 3 checks, check with the allergies. So we're going to check that in the system, make sure, again, we check with the patient whenever we go to the room, and we do our 3rd check with the 2 patient identifiers as we've been doing. And we are also going to make sure that we do that 3rd check, and we're also going to assess the patient, as in make sure the patient has dry, intact skin, the patient has no hair on its skin on where we're putting the patch, and that the site has not been used previously for the last patch. And we need to make sure that the spot that we're using is dry, intact, and clean from the last patch. So we're going to go to the patient now, and I am in the room. And what is your name and date of birth, sir? I'm here with your new fentanyl patch. It is time for your medication, and I have it. It's still in the wrapper. It's not out of the wrapper yet. It's still in the wrapper, and I've done my 2 checks while I was in the medication room. So, what was your name and date of birth?
John Smith, January 1st, 1990.
Okay, great. And you said you had no allergies, correct?
No.
Okay, great. Where was your previous patch?
Over here.
Over here? Okay, can I just, I'm going to put this here in my pocket, since it's still in the original wrapper and I'm not even taking it out yet. Can I see that patch?
Maybe it was over here for the sake of everything.
Okay, well, I'll check over here first.
Okay.
Yeah, it doesn't look like it was over here. Was it over here?
I guess so.
Okay, it was... Well, no, it looks like it was over here. Let me just go ahead.
Okay.
Yeah, it came back here. All right, so I'll just go over here and clean this spot off, since that was where the last patch was. And I wash my hands, and I make sure I have my gloves on, because whenever you're dealing with transdermal patches, you always want to make sure that you have gloves on, because if there's any other medication left on the patch, then you might get that medication on you. And where we don't want the fentanyl patch, for example, you don't want that medication on you. And you're going to make sure that you take the patch off, the old patch, before you put the new one on. And let's say this was the patch, and you're wanting to fold it where the 2 sticky sides are sticking together, and then you dispose of that properly due to facility policy. Some facilities say put it in the sharps container, some facilities say throw it outside of the patient's room, some say throw it in the trash can. It just depends on the facility policy. So take it off, fold it sticky to sticky, make sure that the medication's sticking together. You don't want to fold it where the medication's sticking out. And then you want to make sure that you wipe the patient's, make sure that you get all of the medication off in circular motion to make sure that all of the medication is off from the old site. And then you want to assess the patient's old site. I'm sorry, sir, I wasn't done. I'm so sorry. You want to assess the patient's old site and document everything you see. So the patient, it looks like everything's dry and intact. There's no red irritation, nothing like that. So everything checks out and looks good there. All right, sir, that looks perfect. Great, thank you so much. Okay, great. So since that all checked out, I documented all of that and everything looks great. I'm ready to apply my new patch. So I'm going to get a new alcohol pad here. Make sure everything's good. I'm going to assess this new area. So let me see here. We're going to put this new patch right here. Is that okay with you? And nothing's been here lately, correct? Okay, great. So everything looks dry and intact. There's no hair here, so it should be a good spot. I'm just going to sit here and make sure everything's clean. And I have new gloves on now, and my hands have been cleaned in circular motion. And everything's clean, intact, skin's dry. Okay. And I need to let that dry. And whenever I get this medication out, again, I want to check it, make sure everything's good, do my 3 checks. Okay. And then I need to make sure that I have my gloves on, and whenever I put this medication on, I take it out of the wrapper. I need to make sure that the sticky side is my palm, my glove has, the sticky side's not touching my glove. So the sticky side's going to go directly onto the patient's skin like this, and then I hold it there for 10 seconds. And then once that 10 seconds is up, I don't need to massage the area or anything. I need to just apply pressure with my palm and then hold it firmly for 10 seconds. And then once that's up, I'm going to put a piece of tape here with my initials and the time and the date. That way the next person who comes in will know the time and the date that I put that patch on and who put it there. That way if there's any issues or anything, but I don't want to write that directly onto the patch. You want to put that on a piece of tape. That way that nothing seeps into the patch and doesn't get into the medication or anything. And then take off my gloves, do hand hygiene, and then I want to document everything, all of my findings from the assessment and for the medication, and then evaluate the patient. Do you need anything?
No.
No, you're good. Your position fine. You don't need reposition or anything. No, nothing at all. Okay, and then I'll come back later to evaluate the patient's effectiveness of the medication. Okay, so for the next skill, we're going to be doing injections. So we have intradermal, intramuscular, and subcutaneous. So for the first one, we're going to be doing intradermal. So in order to do intradermal, we're going to take our non-dominant hand and we're going to spread the skin in a ton. So can I see your hand? Okay, so let's pretend like I've already done my hand hygiene and I have on my gloves. And we're going to be using children's Tylenol syringe, and I've already pulled it back some with it just has air in it. So we're just going to pretend like I'm giving an injection here. So these are done for like TB tests. So it's just right here underneath the skin. And you're going to insert, and you want to make sure your bevel's up. So it's the it's the part of the needle that you can see, and you want to make sure that part's up. And you're going to insert it at a 5 to 15 degree angle. So you want to make sure that it's kind of even with the skin. And you're just going to insert it flat against the skin. And you want to make sure that it goes in about 1/8. And the entire bevel goes in, and a small bubble should appear, otherwise known as a wheal. Make sure that you don't put a Band-Aid on top of it, massage it, or anything, because it'll mess up the test. And then you want to make sure you educate your patient on that. So we're just going to take the patient's arm like this, and then just make sure that you go up here. And I have a alcohol pad here before I do all this. So I already have my gloves on. Demonstrating what everything does. Almost forgot to clean with the alcohol pad. So these are baby wipes. I'm going to pretend with my alcohol pad. Okay. So I'm going to clean in a circular motion with my alcohol pad before we do everything. Okay. And then I'm going to take while it dries, make sure it's dry, that way it doesn't sting. And then at a 5 to 15 degree angle, you're just going to take the bevel up, make sure it goes in at a 1/8 degree, and insert the medication slowly. Pull out the same exact degree that you went in. And then do not recap the needle, dispose of it properly. If it has a safeguard, make sure that you slide the safeguard up and make sure that it goes in a needle sharp container and dispose of it properly. That is for the intradermal. So since it's not actual needle, we'll be able to pretend again. And for the intramuscular, we'll use this part. And then, like I said, you don't put a Band-Aid on that. So you don't do anything at all to the intradermal. So for the intramuscular or IM injection, we're going to take our little alcohol pad again, and I've hand hygiene and have my gloves on. And then can you turn your arm this way so they can see? Okay, so you're going to clean in a circular motion. Well, I need you to kind of relax your arm though. Okay, clean in a circular motion. And you want to make sure that you use the Z-track method, or you kind of just make sure that you have the muscle of the skin. So you want to pull the skin, make it flat, and you go in a 90 degree angle, and it's kind of like a quick dart, 90 degree angle, and it goes straight in, pull straight out, dispose of it properly in the sharps container, and you want to make sure you come out at the same exact angle that you went in. Do not recap the needle. You can push your safeguard up if it has a safeguard, and that is intramuscular. Again, do not massage the area. You can put gentle pressure on it, and a Band-Aid if needed, or a gauze. So that is intramuscular. And then subcutaneous, you want to go in at a, sorry, not I need the same arm back, same place. Okay, and subcutaneous, you obviously aren't going to be going the same spot for an actual patient for all of these, but since we're just pretending, for subcutaneous, we'll go and clean the same spot again. And you're going to go at a 45 to 90 degree angle depending on the patient and the type of tissue that the patient has, but it goes in the subcutaneous tissue. So you might need to pinch up on the patient's skin, depending the type of patient. So can you turn your body kind of sideways, not your muscle, because it will make your muscle go. Okay, thanks. So pinch up on the patient's skin, and then you might need to go kind of like at a 45-degree angle, depending on the patient, like that. Or if you pinch up on the patient's skin, you can kind of go like a 90, and you want to inject the medication slowly, like that, and that is for a subcutaneous, and then you pull the medication, or sorry, the syringe straight out like you would put it in, because you don't want to bend the needle or anything inside the patient's arm, and you dispose of it properly in the sharps container. Now, before giving any of these injections though, obviously you would go off of the medication order. So you would check the medication and do the 3 checks and do all that whenever you were drawing up the medication into the vial, which is a different skill that we've gone over. So that is whenever all the checks would occur, and you would check the patient's allergies and do all of that. So we're going to be doing nasal spray. So when administering nasal spray and approaching the patient to administer the medication, after verifying its appropriateness for the medication and the patient, it is important to perform hand hygiene and wear gloves. You always want to ask the patient to blow their nose. So I have a tissue here. Can you use this? Okay. All right. So ask the patient to blow their nose. And you want to make sure that the patient is sitting upright. So the patient is here. And you also want to make sure that whenever they're using the nasal spray that they tilt their head back. And once again, that they should avoid this if they have any spinal issues that we have mentioned before, and if they have limited range of motion. So we have done the 3 patient checks, and I did the 3rd one whenever I came into the patient's room and did my 2 patient identifiers. We've already asked about allergies, checked in the system, and I asked him. So I have my nasal spray here, and whenever I do this, I'm going to take the cap off, and after he uses the nasal spray, we'll clean the cap, and then we will recap it. And since it's multi-vial use, it's only for him though, so it'll go locked back up with his patient medications. So since the patient is sitting here, and then we'll ask him to blow his nose. You don't actually have to blow his nose. All right, so we'll ask him to blow his nose. All right, thank you. All right, and then you can just throw that away. And then I've washed my hands, have on my gloves. All right, so whenever we do this, I'm going to need you to, we're going to inject it to one of your nostrils, and it's going to go in, and we're going to, whenever we put it up one of your nostrils, you're going to hold the opposite nostril whenever it's in the other one, and you're going to breathe in slowly while I compress it, and then I'm going to pull it out before I decompress it. So it will not turn to original position until it's all the way out, and then I'll return it to its original position, okay? Okay, does that make sense? Okay, so just breathe in slowly and breathe out. Okay, you ready? All right, so which one do you want to do first? Either one? Okay, so we're not actually going to put this in your nose, okay? All right, so let's start with this nostril. So I need you to hold that nostril shut, please. All right, so pretend like we have this closed down. All right, breathe in. All right, we'll pull it out, still compressed. All right, and then you can let go. All right. There's that one. Breathe in and out slowly, please. All right, very good. All right, then we can do the other nostril. All right, and we'll put it in, and then compress it, and then bring it out. All right, breathe in and out slowly. You can let your finger go. There you go. All right, great. So whenever we do that, he's going to breathe in and out for a few seconds here, and then he's going to wait for 5 to 10 minutes before he ever blows his nose again. That way, depending on the medication, that way he doesn't blow his nose out. And then we'll repeat this if it's necessary for both nostrils, depending on the patient. And then we will, do you need repositioned or anything? You think you're good? Okay, and then you always ask the patient that, do hand hygiene, document the patient's chart in real time, remove any PPE that you might have before you document the patient's chart, and then evaluate the patient for effectiveness in response to the medication when necessary. And then that should be it.